Welcome to NHIS in a Week, where we give you the happenings and highlights of the authority and the scheme. My name is Shanice Palm. Now to our headlines. NHI Chief calls for unity to end illegal charges in National Health Insurance Scheme. Dr. Da Costa Boaje inaugurates 10 new NHIS offices across Ghana. And NHI focused on upgrading its infrastructure. Now the news in detail. The Chief Executive of the National Health Insurance Authority, Dr. Da Costa Boaje, has reaffirmed the government's commitment to strengthening the National Health Insurance Scheme. Speaking at the inauguration of a new NHIS district office in Swaman in the Western North region, Dr. Boaje praised the current administration's efforts to clear nearly all outstanding claims owed to healthcare providers, emphasizing the government's dedication to expanding health access for all.
In a symbolic move to boost healthcare access, Dr. Da Costa Boaje handed over a new vehicle to the NHIS office in Swaman, enhancing operations across the district. He urged the residents to enroll in the National Health Insurance Scheme to benefit from an expanded package that now covers mental health and dialysis services. Dr. Boaje highlighted the ruling New Patriotic Party's contributions to the NHIS, emphasizing the party's aim to complete its ambitious agenda for healthcare development. Addressing the crowd, Deputy Finance Minister Dr. Alexander Ampabain also encouraged the Swaman community to support the NPP's parliamentary candidate, Frederick Addy, in the upcoming elections. This inauguration marks another step towards the NHI's ultimate goal, achieving universal health coverage for all Ghanaians by 2030.
To our next story. The Chief Executive of the National Health Insurance Authority is calling for an end to the politicization of the National Health Insurance Scheme to achieve universal health coverage by 2030. He made the remarks during a recent visit to the Western North region, stressing the importance of public support for the scheme's expanded benefits.
In a meeting with staff at Sehurioso, Dr. Da Costa Boaje underscored the significance of the NHIS as a national asset, calling on Ghanaians to set aside political differences and rally behind the scheme for improved healthcare access. He highlighted the government's commitment to permanently cover dialysis treatment and encouraged staff to recruit and promote personnel fairly. A recent welfare package designed to enhance employee performance was well received by NHIS staff.
We noted that we needed to provide you with something that will protect you, your spouses, and your children in case you are in distress of disease or death or anything, be it you, your spouse, or your parents. So we took it to the board, and again, the board approved that we engage various insurance companies to cover you and your spouse and your children, 3 of your children under the age of 20 or 25 and below, the 5% top-up of diseases that we do not cover. So we are officially covering you with the 5% of diseases that NHIS do not cover. So it's you, your spouse, your 3 children at the age of 25, your mother and your father. We went a step further to say that no, we need to give you life insurance. So we have protected you till the time of your pension with us. If anything happens to you, you will claim some huge sums of money from the NHIS through the insurance company.
Dr. Abuaje's visit to the Western North, Savannah, and Northern regions included discussions with staff, underscoring the NHIS commitment to achieving its long-term goals for healthcare access in Ghana.
Moving on. In a significant move to enhance healthcare accessibility at the grassroots level, the National Health Insurance Authority has inaugurated a new district office in Dwaboso. The event was attended by a diverse audience including political and traditional leaders, religious figures, residents, and dignitaries who gathered to celebrate the important milestone despite challenging weather conditions. The inauguration was marked by a vibrant community celebration, showcasing the residents' excitement and recognition of the positive impact this office will have on their healthcare services.
During the ceremony, NHIS Chief Executive Dr. Dacosta Abuaje led the proceedings, supported by key officials and local representatives, including Kwabena Minta Akando, Member of Parliament for Dwaboso. The establishment of this office aims to improve healthcare service delivery, ensuring that every Ghanaian has access to quality healthcare. Dr. Abuaje emphasized the NHI's commitment to overcoming barriers to healthcare access, particularly for rural residents who may struggle with digital tools. The inauguration was marked by a vibrant community celebration, showcasing the residents' excitement and recognition of the positive impact this office will have on their healthcare services. Dr. Abuaje noted a significant increase in active NHIS membership, rising from 10 million in 2015 to 17.8 million by December 2023, underscoring the authority's efforts to achieve universal healthcare coverage.
Still on healthcare accessibility, the Chief Executive of the National Health Insurance Authority, Dr. Dacosta Abuaje, inaugurated 10 new district offices of the National Health Insurance Scheme to enhance healthcare access across the country.
The newly established offices are located in Kumau, Sachra East, Achumamponua, Shama, Dwaboso, West Gonja, Ho West, Swaman, Bandai, and Savelugu. During the inauguration of the West Gonja district offices on October 21, Dr. Abuaje emphasized the government's commitment to expanding healthcare infrastructure and expressed optimism that the NHIS active members, currently at 17.8 million, could reach 20.8 million by the end of 2024.
In 2016, our membership was only 10 million. By December 2023, our membership increased to 17.8 million. We added 7.8 million as of December 2023. Our expectation is that we reached 20.8 million. Currently, we are surpassing what we did in December 2023, which means that we are on course to achieving the target of the 20.8 million Ghanaians on the National Health Insurance Scheme.
He reassured healthcare providers of rapid claims payments, while calling for an end to illegal charges for NHIS-covered services.
Still on health, In a significant move for healthcare in Ghana, the National Health Insurance Authority has announced that dialysis will become a permanent feature of the National Health Insurance Scheme Benefits Package. This commitment was made by NHIS Chief Executive Dr. Dacosta Abuaje during the opening of a new district office in Pandai, where he also emphasized the government's dedication to accessible and quality healthcare for all citizens.
Today, as we speak, renal dialysis has been added to the NHIS benefit package thanks to His Excellency Dr. Alhaji Muhammad Bawumia. He really takes care of the vulnerable. He's been eating with lepers, he's been eating with a whole lot of group. Kayayes are now being accommodated, and today, for his action, we have added dialysis. And I can promise the people of Ghana that the dialysis will be added permanently on the NHIS benefit package by December.
Dr. Abuaje's announcement comes after successful pilot programs that provided free dialysis sessions for patients. He assured the public that comprehensive actuarial analysis confirmed the initiative's sustainability and feasibility. The NHIA has expanded its reach by establishing 10 district offices since April, with the latest office upgrade aimed at enhancing access to primary health care. Local leaders and community members welcomed this news with enthusiasm, praising the NHI's efforts to include essential services like dialysis and mental health care in the NHIS benefits package. As the authority continues to build public trust, it aims to ensure that no one is left behind in Ghana's healthcare system.
In a bid to foster unity and improve healthcare delivery, the Chief Executive of the National Health Insurance Authority, Dr. Dacosta Abuaje, engaged staff from the 5 northern regions during a recent debate in Tamale. The event provided a platform for employees to voice their concerns while highlighting the authority's ongoing commitment to staff welfare and regional collaboration.
During the gathering, Dr. Abuaje emphasized that the NHIA views its staff as its most valuable asset. He shared various landmark initiatives aimed at enhancing universal health coverage, such as the e-pharmacy system and the comprehensive staff welfare package.
I believe in an organization that prioritizes the welfare of the staff. And this evening, I'll share with you some of the things that we have done to enhance your welfare that you may not be aware of. And I will also share with you some of the new things that we are bringing on board. And we'll look at the way forward.
The chief executive also condemned illegal charges imposed by some healthcare providers, promising that such practices would soon be eradicated.
That will end the co-payments. We use the system approach and also use the enforcement approach. The system approach is where I talked about the e-pharmacy, I talked about the automatic price adjustment, I talked about we giving the facilities what they need, but we also bring on board the joint task force with the BNI, former BNI, like NID, now we call them. Then we also make sure that some of our staff are now located at the provider site.
With procurement of 8 operational vehicles to aid in mobility, Dr. Abuaje's administration is focused on addressing challenges faced by staff in the northern regions.
Still on inaugurating offices, Ghana's Second Lady, Haja Samira Bawumia, together with the Chief Executive of the National Health Insurance Authority, Dr. Dacosta Abuaje, inaugurated a newly built NHIS district office in Savalugu, marking a significant milestone in expanding healthcare access in the northern region.
During the inauguration, Haja Samira Bawumia commended the NHIA for its ongoing commitment to enhancing healthcare infrastructure across Ghana. She highlighted the transformative impact of NHIS over the past 20 years, emphasizing the unprecedented investments made by the current administration in the health sector.
This health insurance office is part of government's commitment to providing quality health care to everybody in this country. And we thank Dr. Abuaji Da Costa for making it possible.
Dr. Da Costa Abuaji outlined key initiatives under the NHIS Digital Revolution, including the e-pharmacy project and efforts to eliminate illegal charges by healthcare providers.
As we speak now, under the leadership of His Excellency Nana Addo Akufo-Addo and the Vice President of the Republic, Alhaji Muhammadu Bawumia, we have paid all facilities till date. In fact, we are now begging facilities to bring claims for us to pay. As we speak, I don't have any claims on my table to pay. This is remarkable in our 20-year history.
The event signifies a continued focus on improving healthcare services and accessibility for all citizens in the region.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for internet. But no shaking. I have NHIS already.
After you on a line, ting.
Ina, look at you. What are you going to do in your office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Please, Seth, I'm starting work next month.
This is all we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.